through for who's a candidate for deep brain stimulation. So not everybody is a candidate. Really, only certain people become candidates for this procedure. Someone, and probably most importantly, who has a diagnosis of idiopathic Parkinson's disease. We want them to have that diagnosis for at least 4 years because we want to make sure that we're not dealing with something else. There's all sorts of things that really look like Parkinson's disease, especially in the early stages of the process, but turn out to eventually be something else. For example, all of the Parkinson's plus syndromes that you might have heard about. We want someone with idiopathic Parkinson's disease and also who has the motor complications of Parkinson's disease, specifically tremor, rigidity, and bradykinesia, which means slowness of movement. Patients who are good candidates for deep brain stimulation surgery have a great response to medication, specifically the levodopa analogs. Part of the reason for this is because we see that deep brain stimulation is effective in the same ways that levodopa is often effective. It often does the same things for patients, only in a much more consistent manner. A good candidate for DBS is a person who has little or no cognitive dysfunction. And the reason for that is because we know that if patients are in the very late stage of the disease, or if a patient has dementia, either from Parkinson's or for another reason, then deep brain stimulation may actually make that worse, and therefore we don't want to implant those patients. Last but not least, we want a patient who's healthy to undergo surgery. We want to make sure that the surgery itself isn't too taxing for a patient and that they're healthy enough to undergo it before we would consider them a good candidate. And so ultimately the decision's not made by one person, it's actually made by a multidisciplinary committee. All of this information is presented and we sit around in a room and we present several patients, usually either on a weekly or monthly basis, and we talk about all these different components and every patient, so that every patient receives individualized care, because everyone is a little bit different. And then we think about all the risks and all the benefits and decide, is this patient a good candidate for deep brain stimulation?